For my next section, we're going to go over the eye. We're going to start with line of closure, size, and form. The line of closure is known as the line that forms between two eyelids when the eyes are closed and which marks their place of contact. The line of closure occurs in the lower 1/3 of the socket. It's a dipping curve on the lower portion. The upper eyelid covers 2/3 and the lower eyelid covers 1/3. There are different parts of the closed eye. They are the naso-orbital fossa, which is the triangular concave depression superior to the medial portion of the superior palpebrae. The superior orbital area, which is the area between the supercilium, which is the eyebrow, and the superior palpebrae, which is the upper eyelid. So it's going to be right here. You have your inner canthus, which is a small elevation extending medially and obliquely from the medial corner of the upper eyelid. This is the area of your superior palpebrae where no eyelashes grow. Next, you have your cilia, which is your eyelashes, your supercilium, which is your eyebrows, and then your superior and inferior palpebral sulcuses, which are two different acquired facial markings. The next acquired facial marking is the optic facial sulci. This is also known as crow's feet, the wrinkles that you get outside of the corners of your eyes. And then we have the supraorbital margin, which is the superior rim of the eye socket located on the frontal bone. I think that's what I went over. Yep, these are the parts that we just went over. And next we have restoration. The eyes are something you're going to have to restore pretty often. In the prep room we've seen lots of restoration going on with the eyes, whether it's just the closing of the eyes or injecting of feature builder, making the eyes look more natural. They sink very quickly, and lots of different types of things can happen to the eyelids during and prior to embalming that can cause them to distort. So these are a few of the things that can happen to the eye that we're going to go over: sunken, distension, and protruding, discolored, wrinkling, lacerated, separated, swelling of the orbital pouch, dehydrated inner canthus, and then full enucleation. So sunkenness in the eyes is common to decedents who've lost weight or experienced severe dehydration. It also happens because of decomposition. It's very common. Some of the solutions we have are the injection of tissue builder and placing cotton under the eye cap to have that superior palpebrae look more protruding. We also have in the book the option to inject mortuary putty behind the eyeball. For distension and protruding, this can sometimes be caused by gases or fluid because of trauma or severe edema. Some solutions we have for distension or protruding are aspirating of the fluids or gases. This would be done with your small diameter needle, not with a trocar. That's a little excessive. You could also have some external pressure placed on the eye that may reduce the swelling. Or if it's extremely severe, you could remove the entire eyeball if you feel that's necessary and replace it with cotton. Discoloring is something that's next. This can happen because of trauma or decomposition, and the solutions could be applying a bleach compress, hypodermically injecting a bleaching agent, or using cosmetics or some sort of combination of those three. For wrinkling, this could be caused by the reduction of a swollen eye or just an acquired facial marking. The solutions for wrinkling eyelids are placing wax over the eyelid to create a more smooth surface, and then using cosmetics on top of that. You could excise part of the eyelid and replace it with wax to create the smooth surface, or it might be as simple as applying massage cream and using an electric spatula. Next, we have lacerations that can be caused by trauma. Lacerations are not going to be caused by decomposition or anything like that. So solutions are applying massage cream before embalming, and then after embalming, dry and glue the lacerations closed to form a flat surface. Cover the lacerations with wax, and then apply cosmetics. And then option B, which is to remove the entire eyelid and replace with wax. We see that pretty often with several of these causes, is just to take the whole thing off and replace it with something new. That's going to be your most extreme solution to any of these problems, is just to remove what's there and replace it with something that you create. Next, we have the separated eyelid. So this is just another way of saying that the eyelids won't stay closed. Some solutions are using an eye cap instead of cotton. If someone prior to you had placed cotton under there, the eye cap is going to work better. You could apply glue to your eye cap. You could stretch out the skin of the eyelid, or I've seen in lab, excising the levator palpebrae superioris muscle, which is we took an instrument and placed it underneath the eyelid and excised the muscle, and then that eyelid will fall flat and closed. And again, like I said earlier, radical treatment is to remove the entire eyelid and replace it with wax. Next, we have the orbital pouch. So this is the bags you get under your eyes that can become swollen because of embalming and arterial injection. So a simple solution would be just applying external pressure with a moist cotton compress. You could use massage cream and a warm electric spatula. Of course, you want to make sure that it's warm and not too hot so you don't cause any further damage. Or you may want to aspirate this area with a very small needle. Next, we have the dehydrated inner canthus. This is common due to refrigeration and exposure to air. I'm sure at this point we've all seen before the tips of people's fingers or the tips of their toes that are completely dehydrated and almost fully hardened, and you can't really get any fluid into those parts of the body. So the solution for the dehydrated inner canthus is to use massage cream, fully close the eye, and then cover with wax if the dehydration has caused any sort of discoloration. And last, we have enucleation. This is the donation of the entire eyeball. So the solution for this problem is to gently remove the packing material that's placed inside of the eye cavity before embalming. You want to clean and dry that orifice completely and replace the cotton that was in there with a drying agent. Close the eye during embalming and apply massage cream. Slow your rate of flow and pressure during embalming to reduce leakage. After embalming, remove the cotton packing and redo that procedure. So place another drying agent on that piece of cotton, such as phenol. You're going to want to fill that cavity with mortuary putty or cotton to recreate the shape of the eyeball so that when you close the eyelid, it looks natural. Then insert your eye cap and glue close with Aran Alpha if needed. And that's the eye.